And welcome back. Our ABC News 4 hospital experts from East Cooper Medical Center are here this morning to talk about breast reconstruction. And Dr. Thomas Hom joins me with more. Good morning.
Good morning.
Thank you for being here. And of course, this conversation is going to be mostly appropriate because we're coming up on the Susan G. Komen race on Saturday. So let's talk about breast reconstruction in the terms of a woman who's gone through breast cancer and perhaps has, had surgery to remove her breast. Now, what are the different types of breast reconstruction?
Breast reconstruction, the different types, there's just basically really two. One's using your own body tissue, which we call autologous. Autologous meaning using your own tissue. And then the other type would be implant-based.
Implant-based. So for someone with the first option, again, it's called?
Autologous.
Autologous. So what would kind of not make a person a good candidate for that one?
The biggest reason for not using your own tissue would be let me backtrack. The best place I think to use your own tissue from is usually your stomach.
Oh, okay.
Because if you use the tissue from your stomach, making a stomach flat is sort of a win-win.
Absolutely.
Right. So now the reasons why you wouldn't use your own tissue is if you don't have enough tissue, if you're really thin, or you're a young woman unfortunately who develop breast cancer and in the future want to have children.
Oh,
so I think those are the two biggest reasons not to have it.
Okay, now let's talk about how many surgeries will it normally take to have this done?
There's been an increase in doing what we call a single stage, or just one type of one surgery for reconstruction with implants. But the revision rates, the rates that people come back to touch them up, is greater than 50%. So for most surgeries, you're probably going to look at, even if you use your own tissue or implants, you're probably looking at like 2 or 3 surgeries. The first surgery being the biggest one, and the second 2 being sort of touch-ups. As plastic surgeons, we tend to be sort of like artists,
right?
And we like to do touch-ups.
Yeah, right. Now, when it comes to that, how much downtime is normally comes with each surgery, in between each?
Usually the first surgery is the big one. On a scale of 1 to 10, you're probably 10 being the worst surgery and the greatest amount of surgery, probably 8 to 10 the first surgery. The second or third, even fourth surgeries that are touch-ups are probably looking at a complication or complexity level and a pain level of like 1 to 2 with a couple of days, with like a 1 to 2 day recovery time.
And usually it's this time, maybe if we can look at it on a lighter note, on a brighter side of having this procedure done, a woman can basically go with whatever size cup that she would want to. If she was maybe not as ample before, she could, increase that a little bit, right?
You can, but I do think that with implants, if you're using implants to increase your volume, you got to remember that if you're naturally only like a B cup, to go to a bigger than like to a D cup would be too much, I think, mainly because you're stretching and thinning that skin, and so there's less soft tissue covering and protecting the implant.
Gotcha.
So I think I think the good rule of thumb, and this is not for everyone, but this is for me, I think good rule of thumb is about a size difference. If you're about a B, you want to get to about a C with reconstruction with an implant, you can do that. Now, using your own tissue, since I'm bringing in healthy tissue that's your own body's tissue, I can go as big as your body lets me. Wow.
Okay. Now, complication rates and success rates.
The success rates for using your own body tissue can range anywhere from 98 to 99% in terms of success and how they and how well they do. Same thing with implants. You're looking at success isn't measured by, for implants, to me, success is not measured by how well or whether it can be done. It's measured by how long it can stay. And about 30 to 40% of implant-based reconstructions over the next 10 years will require some type of surgery. But for the right patient, that is a great solution.
That is. Okay, and I'm sure someone out there is wondering, okay, is breast reconstruction covered by most insurance?
Breast reconstruction should be covered by every insurance carrier, whether it's Medicare, Medicaid, but there are some policies with some of the government-based insurance companies that can make it a little tricky, but most 99.9% of all reconstructive procedures, breast reconstructive procedures, are covered by your insurance.
All right, well, Dr. Hom, thank you so much. Lots of great information. We appreciate you.
You're welcome.
And there you have the information right there on the screen there, East Cooper Medical Center. Get your questions answered, telephone number, as well as the website right there. More after the break. Stay with us.